Hello everyone, welcome to Nepal Nursing Licensure Examination Preparation Part 4. And in this video, I'm going to discuss about important multiple choice questions of integrated science on blood. Question number 1. The lifespan of WBC is approximately option A, less than 10 days, option B, between 13 to 20 days, option C, between 2 to 3 months, option D, more than 3 months. And the correct answer is option B, that is between 13 to 20 days. And in comparison with RBC, the lifespan of WBC is less. And the lifespan of RBC is 120 days. Question number 2. Blood serum contains option A antibodies, option B immunoglobulins, option C plasma protein, option D all. And the correct answer is all. Blood serum contains everything here which are given in the options. Those are antibodies, immunoglobulins and plasma protein. Question number 3. pH of blood ranges from option A 7 to 8, option B 6 to 10, option C 6.5 to 7.5, option D 7.35 to 7.45. And the correct answer is option D, that is 7.35 to 7.45. Question number 4. In adult, haemopoiesis occur in option A spleen, option B liver, option C bone marrow, option D kidney. And the correct answer is option C, that is bone marrow. So here, hematopoiesis or hemopoiesis is the production of all the cellular components of the blood and blood plasma. It occurs within the hematopoietic system, which includes organ and tissues such as the bone marrow, liver and spleen. So here, in adults, hematopoiesis of red blood cells and platelets occur primarily in the bone marrow, but in infants and children, it also occurs in the spleen and liver. Question number 5. Lifespan of RBC is 150 days. Option B 130 days. Option C 120 days. Option D 100 days. And the correct answer is option C, that is 120 days. Question number 6. The color of oxygenated hemoglobin is option A light red, option B bright red, option C bluish red, option D dark red. And the correct answer is option B, that is bright red. The color of oxygenated hemoglobin is bright red. Question number 7. The normal hemoglobin level in newborn is option A 14 to 18 milligram per deciliter, option B 12 to 16 milligram per deciliter, option C 30 to 40 milligram per deciliter, option D 20 to 22 milligram per deciliter. And the correct answer is option D, that is 20 to 22 milligram per deciliter. And here in hemoglobin level, we should always think that when the baby is newly born, that moment there will be high hemoglobin level, and as the baby grows, the hemoglobin level decreased, and when the baby become adult, then again their hemoglobin level increase. Question number 8. Which of the following is also known as policeman of the body? Option A RBC, option B WBC, option C platelets, option D plasma. And the correct answer is WBC, that is option B. Since WBC helps to fight against bacteria, viruses and pathogens, it is also known as policeman of the body. Question number 9. What increases in acute bacterial infection? Option A eosinophils, option B basophils, option C neutrophils, option D monocytes. And the correct answer is option C, that is neutrophils. Here, neutrophils are a type of white blood cells, WBC or granulocyte. It is known as granulocyte because of granules present in a cell that protect us from infection among other functions. They make up approximately 40% to 60% of the white blood cells in our bodies and are the first cell to arrive on the scene where we experience a bacterial infection. Question number 10. Generally, clotting factors are produced in option A liver, option B kidney, option C spleen, option D pituitary gland. And the correct answer is option A, that is liver. Question number 11. O blood group has option A no antibody, option B no antigen, option C both, option D none. And the correct answer is option B, that is no antigen. Since it does not contain any antigen in itself, that's why blood group O can be given to any individuals, any blood group person. Question number 12. The most commonly type of anemia is option A iron deficiency anemia, option B sickle cell anemia, option C pernicious anemia, option D megaloblastic anemia. And the correct answer is option A, that is iron deficiency anemia. The most commonly type of anemia is iron deficiency anemia. Question number 13. One hemoglobin molecule carries how many molecules? Option A 1 molecule, option B 2 molecules, option C 3 molecules, option 4 molecules. And the correct answer is 4. One hemoglobin molecule carries 4 molecules. Question number 14. The primary stimulus to increase erythropoiesis is option A hypoxia, option B anorexia, option C hyperoxygenation, option D none. And the correct answer is option A, that is hypoxia means low level of oxygen in the body tissues. Here, when there is a low oxygen level in a specific tissue, that makes the liver and kidney induce the production of a hormone erythropoietin. Erythropoietin is a hormone responsible for the increased production of red blood cells in bone marrow. That's why hypoxia is responsible for stimulating erythropoietin in the body. Question number 5. The largest blood cell is option A lymphocyte, option B erythrocyte, option C monocyte, option D neutrophils. And the correct answer is option C monocyte. Here you can see the pictures of types of blood cells. Here we have red blood cells, platelets and WBC. So the largest blood cell is monocyte, which is the blood cells of WBC, which is also known as leukocyte, and the smallest blood cell is platelets, which is also known as thrombocytes. And this platelets helps in blood clotting. All the white blood cells, that is leukocytes, helps fight against infections, and red blood cells helps in oxygen and carbon dioxide exchange, which is also known as erythrocyte. Question number 16. The most numerous leukocytes are option A lymphocyte, option B organocyte, option C monocyte, option D neutrophils. And the correct answer is option D, that is neutrophils. Leukocyte is a type of blood cell that is made in the bone marrow and found in the blood and lymph tissue. Leukocytes are part of the body's immune system. They help the body fight infection and other diseases. Types of leukocytes are granulocytes, and in granulocytes it includes neutrophils, eosinophils and basophils, monocytes and lymphocytes, which are T cells and B cells. And it is also called WBC or white blood cells. Here you can see in the picture, leukocytes is divided into granular and granular. Granular means a blood cells which does not contain any granule particles inside its cells. As you can see in the granular, there are granules present inside the cell. And granular blood cells are lymphocytes and monocytes. And granular cells are eosinophils, basophils and neutrophils. It will be very easy to remember stating that NAB, granulocytes are NAB, name, that is neutrophils, eosinophils and basophils, and the remaining are granular. Question number 17. Wearing out of RBC is done by option A spleen, option B liver, option C bone marrow, option D all. And the correct answer is all. These all organs helps in wearing out of RBC. Wearing out of RBC means destroying the red blood cells and utilizing the remaining components of the red blood cells in production of new RBC. Question number 18. Which of the blood group has a maximum frequency of occurrence? Option A, option B, option C, AB, option D, O. And the correct answer is option D, that is O. O blood group has a maximum frequency of occurrence. Question number 19. The normal platelet count is option A 400 to 11,000, option B 1.5 lakhs to 4.5 lakhs, option C 4 to 9 lakhs, option D 5.5 to 6 lakhs. And the correct answer is option B, that is 1.5 lakhs to 4.5 lakhs. Question number 20. Universal blood donor refers to which blood group? Option A, option B, option C, AB, option D, O. And the correct answer is option D, that is O. And the universal recipient blood group is AB blood group. Question number 21. Which of the following in the body's largest blood vessel? Option A, aorta, option B, capillaries, option C, pulmonary vein, option D, heart. And the correct answer is option A, that is aorta. Question number 22. Graveyard of RBC is option A, spleen, option B, kidney, option C, thymus, option D, liver. And the correct answer is option A, spleen. Question number 23. What is serum? Option A. Whole blood sample from which all cells are removed. Option B. Plasma from which fibrinogen and clotting factors are removed. Option C. The protein of the blood that is composed of the red blood cells. Option D. Plasma from which only albumin and globulins are removed. And the correct answer is option B, that is plasma from which fibrinogen and clotting factors are removed, is known as serum. Question number 24. What is the name of iron containing protein that gives red blood vessels their color? Option A, hemocyanin, option B, pyrite, option C, hemoglobin, option D, myoglobin. And the correct answer is option C, that is hemoglobin. The name of iron containing protein that gives red blood vessels their color is hemoglobin. Question number 25. Platelets are formed from what type of cells? Option A, melanocytes, option B, macrophages, option C, astrocytes, option D, megakaryocytes. And the correct answer is option D, that is megakaryocytes. Platelets are formed from megakaryocytes. Here in this video, I have included most of the important multiple choice questions on blood, which have the possibility to come in nursing license exam and even in the medical entrance examination. If you like the video, then don't forget to like and share. And type in comment section for the topic that you want in next video. Thank you for watching. Keep studying. Bye bye. See you in next video.